Well, we wanted to really have a conversation with therapists because it's been 50 years since general systems theory was proposed, and at that time there was a huge revolution in psychotherapy. So more than one client was invited into the consulting room. Couples came in, children came in, families came in, and great ideas were proposed, like homeostasis and feedback, and all kinds of therapies really sprang up. But it's been 50 years, and we now know that the therapies are not that effective. And yet, what we wanted to do is have a conversation with therapists because we can now really finish the job. And we have an effective theory, we have an effective therapy, and we wanted to talk to clinicians about how things have changed, how we now can measure what homeostasis is. We now can measure how feedback is provided. We can really look at the couple as a system. We can understand relationships, and we know how to help them. We know what happens when a baby comes in to a relationship, and how to create a systems theory that includes the baby, includes children as we grow up, that includes physiology, the child's regulatory physiology. And we wanted to speak to clinicians in a real conversational way, in a breezy way, so you can absorb these concepts and they can be useful in your own work.
Yeah, I think we also really wanted to integrate together all of the fantastic research that's happened out there and the mathematics that John has done. But keep in mind, John is married to me. I don't get mathematics at all. And so what that means is that, thanks, Lovey. But what that means is that we also really wanted to write a book that therapists really, again, could understand the science, could really get it step by step by step to how did we get from the very beginning where we knew absolutely nothing, right, to the point of really, really understanding the intricacies of both couples and families scientifically, without my glazing over, or anyone else for that matter glazing over, who may not really quite get the mathematics. This is a book that really translates all of that for all of us who don't have brains like this, but really want to understand the foundation of how to do really effective couples therapy. And on top of that, we're also explaining the couples therapy as well to integrate both the science and the methods of doing therapy so the whole picture makes sense.
Let me give you one example. So we have a chapter on change. And a lot of times you're sitting, with a couple and you're kind of going, I wonder what they'd be like if he was a little nicer to her. He just was kinder, more generous. He was nicer to her. Well, we can now do the math that actually simulates what he would be like and what they would be like if he was nicer. And we can actually answer questions like that. So you can think effectively about change and the parameters that create change, so that now change isn't this sort of in the sky concept that you can't understand, but it's really the kind of stuff that we deal with. It's the stuff of therapy. You're sitting there thinking, okay, how can I get these people to be different so their relationship is much more satisfying? Well, this gives you a way of thinking about change.